That out of the way, Dr. Bedigal, would you start us off?
Good morning and welcome to this week's COVID-19 briefing. In the last 2 weeks, the COVID situation across the country and in our region has changed dramatically. After we announced our COVID response levels, intended to guide how the city responds to the pandemic, the CDC also announced their community levels. I'll get into the differences between our levels a little later, but these new levels have caused a number of other jurisdictions to rethink how they're responding to the pandemic. At the same time, we continue to learn more about the pandemic and how it's changed. But first, let's give you an update on how things are going. As of yesterday, we're seeing an average of 87 new cases of COVID per day. While this number is only about 2% of what we saw during the Omicron peak, it's still about 3 times higher than the lows we saw last summer before the Delta wave. We also reported that there were 156 people who've tested positive for COVID in Philadelphia hospitals. That number is only 10% of what we saw during the Omicron peak, but still about 3 times higher than the lows we saw last summer. In terms of vaccines, the number of people getting their shot is slowing down considerably. Each of the age ranges we have received who have received at least 1 dose have only gone up by about 1%. But more than 1 million Philadelphians are fully vaccinated now, which amounts to more than 75% of Philadelphians over the age of 12. Nearly 400,000 Philadelphians have received a booster dose, or just about 1/3 of adults. And of course, all the rest of the numbers are available on our vaccine dashboard on phila.gov/COVID. In the last couple of days, we have received many questions about the CDC's response levels and what they mean for us. As you know, Philadelphia's COVID response levels were developed based on analyses of detailed local data with the goal of predicting and preventing high rates of hospitalization and death. We're currently looking at 4 local metrics to determine our response level: cases, hospitalizations, the percent of tests that come back positive, and the rate of rise in cases. The CDC's rubric looks at case rates, hospital admission rates, and hospital capacity. Philadelphia is unique in that we are the poorest big city in the country, making us more vulnerable to COVID-19 than many places in the country. But we do have strong local data capacity, enabling us to look at data in ways that may be out of reach of many US counties. We also share a commitment to each other, and we've shown that commitment throughout the pandemic in the many ways that we have taken care of each other, perhaps best demonstrated by our willingness to wear masks for the past 6 months to help decrease transmission to those who remain at risk. So while we agree that with the CDC's concept of response levels and the use of transparent metrics, the specific metrics they're suggesting feel risky for Philadelphia. Our team looked back and found that if we had been following the CDC's model in Philadelphia this fall, we would have remained unmasked throughout the Delta wave, during which it appears that Philadelphia's mask mandate prevented large numbers of COVID cases. So now let's talk about our COVID response levels. As I've said before, we're always looking at our work to see if there's something we can correct or improve. Some people have noticed that our percent positive figure has not dropped as quickly as you would expect. We looked into this and found that the percent positive number that we were using for the COVID response levels only tracks the positivity of PCR tests, not antigen tests, as you know. Throughout most of the pandemic, that was fine because PCR tests were all you could get. So by tracking that, we were able to get a good sense of the positivity. Now that antigen tests and rapid at-home tests are much easier to find, more and more people are using them. And we don't learn about many of the negative test results, which skews our percent positive rate. I've directed our staff to start calculating the percent positive rate for the combined PCR and antigen test results that we do receive. And they tell me that with the new calculation, we are under the 2% positivity rate, 1.7% to be exact. So according to our COVID response levels, I now declare that Philadelphia is moving into the all clear level, effective immediately. This means that we will no longer be enforcing the indoor mask mandate in most settings. You'll still need to wear masks in schools, all schools, including public, private, archdiocese, and charter, and early childcare, in healthcare settings, congregate living settings, and on public transit. For schools, we'll continue to watch and evaluate the data. If it continues to move in the right direction, we plan to end mandatory masking in schools on March 9th, with a 1-week mask requirement after spring break to avoid a post-break surge in cases. I also want to note that businesses and other institutions can still require vaccine proof or masks. Employees and people entering indoor spaces still have the right to wear masks. As we've done throughout the pandemic, please give each other the gift of understanding that we can't know another person's circumstances, so we don't want to judge their reasons for wearing a mask if they choose to do so. So what does that mean for our recommendations now that we're no longer enforcing the mask mandate? We recommend that everyone who's eligible get up to date on their vaccinations as soon as possible. You all knew I was going to say that. If we're going to be around large crowds of people indoors, consider wearing a mask, particularly if you live with people who remain unvaccinated or are at high risk. If you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. One last thing. With today's announcements, this will be our final regularly scheduled COVID briefing. Should there be a change in the COVID response level or the need for another type of announcement, we will have another briefing. Thanks to all of you for your continued work to inform the public throughout this pandemic. And now let me turn it over to Zelly.
Buenos días y bienvenidos a la sesión informativa COVID-19 de esta semana. Durante las últimas 2 semanas, la situación del COVID en todo el país y en nuestra región ha cambiado drásticamente. Después que anunciamos nuestros niveles de respuesta COVID destinados a guiar cómo responde la ciudad a la pandemia, el CDC también anunció sus niveles comunitarios. Entraré en las diferencias entre nuestros niveles un poco más tarde, pero estos nuevos niveles han causado que varias ciudades, estados y condados de nuestra región reconsideren cómo están respondiendo a la pandemia. Al mismo tiempo, seguimos aprendiendo más sobre la pandemia y cómo ha cambiado. Pero primero, vamos a darle una actualización sobre cómo van las cosas. Hasta ayer, estamos viendo un promedio de 87 nuevos casos de COVID por día. Sí, bien. Este número es solo alrededor del 2% de lo que vimos durante el pico de Omicron. Sigue siendo aproximadamente 3 veces más alto que los mínimos que vimos el verano pasado antes de la ola de Delta. También informamos que hubo 163 personas que dieron positivo por COVID en los hospitales de Filadelfia. Ese número es solo el 10% de lo que vimos durante el pico de Omicron, pero sigue siendo aproximadamente 3 veces más alto que los mínimos que vimos el verano pasado. En términos de vacunas, el número de personas que reciben su vacuna se está desacelerando considerablemente. Cada uno de los rangos de edad que han recibido al menos una dosis sola han aumentado aproximadamente 1%. Pero más de 1 millón de filadelfianos están completamente vacunados, lo que equivale a más del 75% de los habitantes de Filadelfia mayores de 12 años de edad. Casi 400,000 habitantes de Filadelfia han recibido una dosis de refuerzo, o solo alrededor de 1/3 de los adultos. Todos los demás números están disponibles en nuestro panel de control de vacunas en phila.gov/COVID. En los últimos días hemos recibido muchas preguntas sobre los niveles de respuesta de la CDC recientemente anunciados y lo que significan para Filadelfia. Como saben, los niveles de respuesta COVID de Filadelfia se han desarrollado sobre la base de análisis de datos locales detallados con el objetivo de presidir y prevenir altas tasas de hospitalizaciones y muerte. Actualmente estamos analizando 4 métricas locales para determinar nuestro nivel de respuesta, casos, hospitalizaciones, el porcentaje de pruebas que dan positivo y la tasa de aumento de casos. El CDC está analizando las tasas de casos, las tasas de admisión hospitalaria y la capacidad hospitalaria. Filadelfia es única en el sentido de que somos la ciudad más pobre del país, lo que nos hace más vulnerables al COVID-19 que muchos lugares del país. Pero tenemos una sólida capacidad de datos locales, lo que nos permite ver los datos de maneras que pueden estar fuera del alcance de muchos condados de los Estados Unidos. También participamos un compromiso mutuo y hemos demostrado ese compromiso a lo largo de la pandemia en las muchas formas en que nos hemos cuidado unos a otros. Tal vez mejor demostrado por nuestra voluntad de usar máscaras durante los últimos 6 meses para ayudar a disminuir la transmisión a aquellos que permanecen en riesgo. Entonces, sí, bien, estamos de acuerdo que en el concepto del CDC y los niveles de respuesta y el uso de métricas transparentes, las métricas especificadas que sugieren se sienten riesgosas para Filadelfia. Nuestro equipo mira hacia atrás y descubrió que si hubiéramos estado siguiendo el modelo del CDC en Filadelfia este otoño, habríamos permanecido desenmascarados durante toda la ola de Delta, durante cual parece que el mandato de máscaras de Filadelfia evitó un gran número de casos de COVID. Así que ahora hablemos de nuestros niveles de respuesta a COVID. Como hemos dicho antes, siempre estamos mirando nuestro trabajo para ver si hay algo que podamos corregir o mejorar. Algunas personas han notado que nuestra cifra porcentual positiva no ha disminuido tan rápido. Analizamos esto y descubrimos que el porcentaje de positivos que estábamos utilizando para los niveles de respuesta a COVID solo rastrea la positividad de las pruebas PCR, no las pruebas de antígenos. Durante la mayor parte de la pandemia, eso estuvo bien porque las pruebas de PCR eran todo lo que se podía obtener. Por lo que el arrestar eso, pudimos tener una buena idea de ese número. Ahora que las pruebas de antígenos y las pruebas rápidas en el hogar, con mucho más fáciles de encontrar, cada vez más personas las usan y no aprendemos sobre muchos de los resultados negativos de las pruebas, lo que cega nuestra tasa de porcentaje de positivos. He ordenado a nuestro personal que comience a calcular la tasa de porcentaje positivo para las pruebas combinadas de PCR y antígenos. Y me dicen que con el nuevo cálculo, en realidad estamos debajo de la tasa de positividad de 2%, 1.7% para ser exactos. Entonces, de acuerdo con nuestros niveles de respuesta, COVID declaró que Filadelfia se está moviendo a nivel all clear, todo claro, con efecto inmediato. Esto significa que ya no haremos cumplir el mandato de mascarillas en interiores en la mayoría de los otornos. Todavía tendrán que usar máscaras en las escuelas, incluido las públicas, privadas, católicas y charter, los entornos de atención médica, los entornos de vida congregada y en el transporte público. Para las escuelas, continuaremos observando y evaluando los datos. Si continúa avanzando en la dirección correcta, planeamos poner fin al uso obligatorio de máscaras en las escuelas el 9 de marzo, con un requisito de máscaras una semana después de las vacaciones de primavera para evitar un aumento de casos después de las vacaciones. También quiero señalar que las empresas y otras instituciones aún pueden requerir pruebas de vacunas o máscaras. Los empleados y las personas que ingresan a espacios interiores todavía tienen derecho a usar máscaras, como lo hemos hecho a lo largo de la pandemia. Por favor, dense el regalo de entender que no podemos conocer las circunstancias de otra persona, por lo que nos queremos juzgar. No queremos juzgar sus razones para usar una máscara si deciden hacerlo. Entonces, ¿qué significa eso para nuestras recomendaciones ahora que ya no estamos haciendo cumplir el mandato de la máscara? Recomendamos que todas las personas que son elegibles se pongan al día con sus vacunas lo antes posible. Sí, va a estar cerca de grandes multitudes de personas en interiores, considere usar una máscara, especialmente si vive con personas que permanecen sin vacuna o están en alto riesgo. Si desea obtener más información sobre la pandemia y la respuesta de la ciudad, puede visitar nuestro sitio de web, phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Una última cosa con los anuncios de hoy. Esta será nuestra última sesión informativa COVID programada regularmente. Si hay un cambio en el nivel de respuesta COVID o la necesidad de otro equipo de anuncio, tendremos otra sesión informativa. Gracias a todos ustedes por su continuo trabajo para informar al público durante esta pandemia. Muchas gracias. Thank you very much.
Thank you very much, Zelly. We'll now move to the question and answer portion of our program. I think everybody remembers the rules. So first up, we're going to go to, it looks like David Melandra from Philly Sports Network. Go ahead, David. You should be able to unmute.
Yes, I just have one question. With this, with the mask mandate being lifted, does that apply to all like entertainment venues like the Wells Fargo Center?
So after this long, I feel like I could have asked that question for you today. Yes, it does. I mean, I will say, the way I'm thinking of this is that each of us now are responsible for our own risk and the risk we take for the people we love. So, think about your risk budget, if you want to think of it that way. When is it really worth it to you to take off your mask and take some additional risk? Because there's still COVID out there, right? And when do you want to keep your mask on? Because it doesn't matter that much. So if you can enjoy the game and do your screaming inside your mask, maybe you decide to keep your mask inside a facility with a lot of people in it, but we are no longer mandating that.
All right, thank you.
Thank you very much, David. Next up, we're going to go to Isabel Sanchez from Telemundo 62. Go ahead, Isabel.
Hello, Dr. Bedigol. I'm sure this is a little bit obvious, but just want to be very clear. Things can change, correct? If numbers for whatever reason start changing, people should not necessarily start dropping or trashing their masks just because this might change in the near future.
Please, yes, things may change. I mean, we are continuing to look at our metrics and to try to refine and make things better and stronger and more useful. But of course, we can get hit with another variant. Things can happen. So yes, keep your masks somewhere. And again, COVID is still here. It's at a much lower rate. We think it's safe to do this. But, you still may want a mask if you're going into a crowded indoor place. The fact that it's no longer a mandate doesn't mean it might not be a good idea.
Thank you so much.
Thank you very much, Isabel. Next up, we're going to go to Jason Laughlin from the Inquirer. Go ahead, Jason.
Hi, thanks for coming to me. Can you talk a little bit about the adding the antigen tests into your calculations? Why hadn't they been a part of it before? And by doing this, are you changing the metrics that you laid out 2 weeks ago for the city's benchmarks?
So to answer the second part of your question first, I mean, clearly this is a change, but the intention of that metric was to include both what I think of as diagnostic tests that are done because somebody came in with symptoms, and screening tests, the totality of the tests being done. The reason we didn't have antigen tests in our metric actually dates back a long way, because we've been looking at many, many, many pieces of data for a very long time now. When we first had antigen tests, we really had a very small number of them. And our typical pattern was if somebody tested positive or negative, we would usually back it up with a PCR. I mean, not necessarily the positives, but the negatives. So, you know, for a long time, we didn't know exactly what to do with those. So we would report them separately on our internal report. And we didn't necessarily include them in the true positives. But these days, that's not how we use them, right? We use antigen tests routinely for screening. We typically don't back up with the PCR anymore because it's days before you get that back sometimes. And so we kind of use the antigens as our action step, except in certain specialized situations. So it makes sense now. It's a little bit of a historical relic from our data that it wasn't included. And you know, essentially what happened is we were trying to unpack why that positivity was staying stuck when cases continued to decline. It didn't really make sense to us, and that's how we came to this.
Okay, that makes sense. You had said previously that you will be making any changes in the status of the city on Mondays. By doing this on a Wednesday, is that changing anything, or from here forward, would any changes happen on Mondays?
So we also said if there was anything big, we would announce it in between. This seemed big. You know, forcing people to do something that we no longer think they have to do seemed worth announcing in between. But typically, you know, we'll update on the numbers on Mondays. And again, if it's in the other direction too, if there's a big increase, we'll let people know in between.
Thanks.
Thank you very much, Jason. Next up, we're going to go to Miguel Martinez Valle from NBC 10. Go ahead, Miguel.
Hey everybody. All right, so my question is just specifically for city buildings. When does mask optional start for city buildings, or is that including today as well?
So we're going to do that on March 7th. We need a little time to deal with signage. And I will say this is going to be true for many institutions around the city. So the fact that we aren't mandating, you know, any business, any institution can choose to continue to require masking, and some of them may just want a few days, or some of them may want to keep it indefinitely. So you may see, you know, things gradually unfold. I am surprising a lot of people right now.
Perfect, thank you.
Thank you very much, Miguel. Next up, we're going to go to Eddie Kadim, Fox 29. Go ahead, Eddie. You should be able to unmute now.
Thank you. I just wanted to kind of go over again what the decision to go back to masks for schools after spring break, what kind of went into that?
Sure. So we've been in conversation with the school district and with other school partners. And, you know, we wanted to be able to give people a date on which we're going to roll back, because I think that there's a lot of interest in that. We don't want to keep masks longer than we have to. But we did have concern that, you know, just like we saw over Christmas break, over spring break, there's going to be a lot of gathering, a lot of travel. There is potential to have another wave. And, you know, with schools, top priority is kids in school learning. So we didn't want to have something happen that would lead to lots and lots of school cases, schools ending up having to close. And so we figured 1 week of masking, you know, after spring break gives us that cushion and that protection.
Eddie, any other questions?
Nope, thank you.
Thank you very much. Next up, we're going to go to Rudy Chinchilla. Oh, actually, we've actually had somebody from 10. Rudy, I'm going to come back to you after we get to Carolina Rodriguez from Univision. Go ahead, Carolina. You should be okay to speak.
Hello, good morning, everyone. Hi, Dr. Bedigal. I was wondering, is it time for us to start referring to an endemic instead of a pandemic in Philadelphia?
You know, it's not language I love. I think talking about regaining as much normal life as we can, I feel like is better framing for me. You know, how can we do as much of the things we love, be safe and so on, and move forward into the future? I like that language better.
Okay, but are we aligning with the State Department of Health? Last week, they mentioned Pennsylvania might be moving towards an endemic, referring to an endemic instead of a pandemic. And we have a lot of people asking us if we are actually at the end of the tunnel when it comes to the coronavirus pandemic in our region.
So, you know, I don't want to go into a lot of details of this, but endemic doesn't mean it's all fine. It means kind of it's here, it's entrenched, we can't get rid of it. And so, you know, we talk about endemic polio, for example. So that's the reason that I don't love that language. You know, in terms of, can we say the pandemic is over? It's, I don't know about you, really hard for me to forget January and what hit Philadelphia in January and just massive number of cases and deaths. So I am very hesitant to say it's over. What we're saying today is right now we are in a much safer space than we were a few months ago, even a few weeks ago. And so we no longer need to require these restrictions. People can go about their lives, feel a little bit more normal. I think we all have to stay alert. You know, we do not know what's happening next. We know that internationally there remain large numbers of people who are unvaccinated. So there is risk of another variant. So, you know, I think we should enjoy the good parts when they're here, and we should stay alert and be careful of what could still be to come.
Finally, Dr. Bettigal, a few weeks ago, you mentioned that we're going to have a lot of cases in January, a lot of hospitalizations in February, and a lot of deaths in March. Is that still the pathway we're going to see in Philly?
So it all happened much faster. Omicron has a much faster incubation period. It's only about 2 to 3 days. And so what I was imagining would be laid out over a couple of months was all smashed into those first few weeks in January. And, you know, I think when we look at the cases, we recorded close to 60,000 cases of COVID in Philadelphia in January. The reality, because we were short of tests and so many people couldn't get tested, the reality is probably in the hundreds of thousands. So, you know, Omicron is milder. We've had fewer deaths than we would have if that had been a different variant, but we are still recording a considerably higher death rate because of the lag with COVID. I don't necessarily anticipate that continuing far into March. I'm hopeful that, you know, I mean, numbers look much, much better. So it really was much faster than anything we've seen before.
Thank you very much. Have a great day.
Thank you, Carolina. Philly Business Journal hasn't had a chance to ask a question yet. So Ryan, I'm going to come to you next. Ryan Milligan from Philly Business Journal. You should be able to unmute.
Hi, Dr. Bettigal. Is there a plan for ending the mask mandate on public transit, or when do you think that could come?
So that is a federal mandate. My guess is it will happen relatively soon, but we do not control that one.
Ryan, you can
thank you.
Thank you very much. Rudy Chinchilla from Channel 10. Rudy, if you got a question real quick.
Thank you. Yeah, just real quickly, Dr. Bettigal, you mentioned rapid at-home tests. How are you guys collecting the data from those tests? Since a lot of people, it doesn't seem like they're reporting their results, whether positive or negative. And yeah, that's sort of what I'm curious about.
Yeah, so there are some rapid tests that we get because they were done either by one of our sites or by a group that's screening that reports to us. And so we still do get a large number of those tests. That will likely change in coming weeks and months, you know, as there's less screening done. So that's what I mean when I say, you know, we are going to continue to look at our metrics and tweak them depending on the situation with the best available data for the city at the time. As screening tests go away, you know, we'll have to look at how useful that metric is. So you may expect to see some changes in our rubric over the next period of time. But, you know, we want to make that looking at the data and trying to figure out what's needed. So we get them from screening right now.
Okay, cool. And then the other quick question was, you know, do you anticipate, given now that I guess Philadelphians are being given, I guess, a little bit of a taste of freedom, do you expect any blowback, or do you trust in this the residents to respond well if indeed we at some point, hopefully not, right, have to institute more stringent policies again because cases might be rising again, or hospitalizations or something like that?
So my commitment to Philadelphians is not to institute rules lightly. And, you know, so far our city has done a really terrific job at doing what we need to do to stay safe, at masking when we have to mask, you know, at getting vaccinated because we needed to. So, you know, I think it depends what this pandemic throws at us. I'm hoping that, you know, we have enough immunity in the city now that we really are at an endpoint. But, you know, confident in the people of our city to do what they need to do if something bad comes at us.
Awesome. Thank you, Dr. Beckel.
Thank you so much, Rudy. Jason, if you want to reach out to us separately, we'll be able to provide you with an answer. We've run over time, so I do want to be cognizant of folks' times. So with that, I'm going to end today's briefing. And I wanted to repeat our programming note before we sign off. Today is our final regularly scheduled COVID briefing. Should there be a change in the COVID response level or the need for another type of announcement, we will announce that briefing via media advisory and on social media. Thank you all for helping us navigate and respond to this crisis. Have a good day.